Welcome to the training on effective use of the telementoring application. In this video, we go through 4 main modules. The first module is the effective use of pointing and drawing features. The second is improving trainees' engagement. The third module is avoiding miscommunications in pointing instructions. And the fourth module is changing the view and presenting it. Module 1, Effective Use of Pointing and Drawing Features. Pointing is a way of presentation. The trainees need to attend to the pointer. Talk about the pointer before using it. Refer to the pointer with a specific name and be consistent with that name, such as laser light, the little dot, or the green thing. Here is an example of talking about the pointer before using it.
Do you see my little dot here that I'm moving? This is the pointer I use to instruct you and point at organs.
You should only use the pointer when intended. If the pointer is not being used, clear it away from the screen. Do not leave it hovering over an area. If left hovering, trainees may interpret this as instructional information and mistakenly follow it. You may also want to inform the trainee that you are turning it off. Attention must be paid to the location of the pointer at all times. Here is an example of a wrong practice, the pointer hovering around. Note the pointer hovering around the bottom of the display where the arrow shows without instructional intention.
Yes, that is a good trajectory. Keep cutting there.
Now an example of a right practice. As you can see, the pointer is cleared away.
Yes, that is a good trajectory. Keep cutting there.
Note the pointing and drawing division of roles. Pointing can be used for referencing, such as showing a location to clip. The drawing tool is preferred over the pointer for representing gestures, such as directions of the actions or shape of anatomies. Here is an example of pointing for showing a location.
Now I want you to put a clip right down here.
Now here is an example of drawing for showing a trajectory.
What you need to do now is to cut right along this line.
Module 2, Improving Trainees' Engagement. Ask the trainee for words of confirmation and understanding. Understand that there is an imbalance of collaboration, as the trainee does not have access to the pointer as a means of communication. This can cause trainees to passively accept information, aka follow the pointer and not contribute to the decision-making. Here is an example of asking for words of confirmation.
Do you see what I'm showing you? The trajectory, the path of movement, how to get there.
This is an example of engaging the trainee in decision-making.
Okay, what do you think you should do next?
Separate the peritoneum of the blood vessel.
Module 3, Tips on Avoiding Miscommunications in Pointing Instructions. Be cognizant of the fact that a pointer only conveys a single focal point of view at a time. break down instructions, both verbal and pointer, into a sequence of steps rather than providing a large chunk of instructions at once. Wait for the trainee to perform a task before providing the next instruction. Here is an example of a wrong practice of giving a large chunk of instructions at once.
So with your non-dominant hand, I want you to grab this tissue right around here and pull it to the left. And with your dominant hand, cut this tissue along this line.
Now here is a right practice of breaking a large chunk of instructions into small steps.
So with your non-dominant hand, I want you to grab this tissue right around here and pull it to the left. And with your dominant hand, cut right along this tissue. Perfect.
Avoid using the pointer simultaneously with complex verbal instructions. This may cause the trainee to ignore the verbal instruction and passively follow the pointer. With complex instructions, provide the verbal instruction first, pause, and supplement the instruction with the pointer. Here is an example of the wrong practice of using the pointer with complex verbal instructions.
I want you to pick up the tissue right around here somewhere. Pick that peritoneum and you're gonna dissect. So with your non-dominant hand, you're gonna grab and retract, and you're gonna dissect underneath here to find the blood vessel and separate the peritoneum of the blood vessel. So go for that.
Now here's an example of the right practice of providing verbal instruction first and then supplementing the instructions with the pointer.
Now, I want you to dissect and separate the peritoneum of the blood vessel. To do so, you need to pick the peritoneum with your non-dominant hand and retract with your dominant. So pick up the peritoneum right around here with your non-dominant hand. Great.
Module 4. Changing your view and presenting it. If you want to have a slightly different view than what the trainee is showing you, you can change your view by zooming, panning, or rotating, rather than asking the trainee to move the endoscope, which may create an interruption. You can also choose to present your view to the trainee so that they can see exactly the same as you. You can zoom, rotate, and pan the view to create the view you need. The trainee will see a rectangle that represents your current view, what you can see. If you want the trainee to see exactly what you see, you can present your view. You may want to do this in order to teach your trainee how to view endoscopic images, to create the correct perspective. Here, the trainee will also see the changes to the view as you zoom, pan, and rotate. To summarize, we went through 4 modules. The first module included trainings on effective use of pointing and drawing features, such as talking about the pointer before using it, clearing the pointer away from the screen when it is not being used, and using the pointer for showing a location, and using the drawing tool for showing directions, orientations, and shape of anatomies. The second module gave advice on improving trainees' engagement, such as asking the trainees for words of confirmation and understanding, and engaging the trainee in decision-making. The third module included tips on avoiding miscommunications in pointing instructions, such as breaking down large instructions into small steps and avoiding using the pointer simultaneously with complex verbal instructions. Finally, the fourth module showed you how to manipulate your view based on your needs without interrupting the trainee, as well as how to present that view to the trainee.